And now let's focus on a very specific type of violence perpetrated against women that is still very taboo. So-called obstetric and gynaecological violence. It encompasses different forms of harmful practices within gynaecological care, including verbal aggression, disrespecting the privacy and the will of women during childbirth, and even physical abuse. To talk more about it, I'm joined by our Health and Science Editor, Julia Seeger. Hi, Julia.
Hi, Annette.
The issue of obstetrical violence and the disrespect of female patients came to light in France back in 2014, didn't it?
That's right. In 2014, thousands of women took to social media platform, at the time it was Twitter, with several hashtags and shared their testimonies about brutal vaginal examinations, about medical acts that were carried out without their consent, and even sometimes, as you said, including sexual violence. So the way we could actually define it today is all the gestures, words, practices, and behaviors carried out or omitted by the medical staff during OBGYN and obstetrical follow-ups that were perceived and experienced as abusive by the patient. So it can sound quite vague and subjective, but actually when you listen to the testimonies, you keep on hearing the same stories. Women are describing the same type of behavior over and over again about some doctors. Of course, it's not all doctors, but some of them. And it goes indeed, as you said, from verbal violence to physical violence. So when you look at verbal violence, for instance, here in France, you often hear women say they've been told that they were hysterical. That's actually what happened to me during childbirth. This is actually quite widespread. You also hear doctors that are going to, threaten women, say, if you don't lose weight during your pregnancy or if you put on too much weight, I will not deliver you. If you refuse labor induction, I will not keep on being your doctor after this. This is something we actually hear quite often, and it's considered as normal. You also hear negligence in care. That's actually refusing to acknowledge the pain that's being described by the patient, and so hence refusing to administer or just an epidural. You also have, we hear this a lot, the lack of information, the lack of consent. And here the example that comes to mind is the fact that you can trigger labor manually. Well, that's actually done to women a lot in France without even telling them that it's going to be done. So it happens to you, you turn around, you're like, what happened? And they tell you your labor has been triggered. And that's actually, this prohibited by law since 2002 in France. It's absolutely forbidden to provide care for a patient without informed consent.
It goes from verbal violence to physical violence, and there is a large continuum of types of harmful behaviour.
That's right. We hear a lot about the brutal vaginal examinations, and you have to understand that auscultations can be very painful for certain women more than for others. Women who, for instance, have been victim of sexual assault or suffer from endometriosis, but it can also be the fact of carrying out, for instance, a C-section or an episiotomy when it wasn't necessary. Now, here it's important to really underline the fact that medicalization of childbirth has been a huge step forward. It's really reduced maternal and infant mortality in a big way. But the problem is that today, it's believed that maybe we're resorting to this a little bit too much. If you take a look, for instance, here, you have some nations that display huge C-section rates. For instance, Turkey, it's 1 in 2 women. France, it's 1 in 5 women. But you actually have countries like Sweden and the Netherlands who are much closer to the recommendation of the WHO, which is about 10 to 15% of C-section. And everything above that is actually considered medically unjustified. So what it means is that, and if you actually look at the mortality rate, you can see that Sweden and the Netherlands have actually the lowest mortality rate. So it doesn't, when you do more C-sections, it doesn't mean you're saving more infants. That's what's really important. And today we're in a world where some specialists are describing it as divided into the global south, where it's still too little, too late, with too high mortality rates for mothers and children. But in the global north, we're actually having this over-medicalization problem where it's almost too much too soon. And so the thing is, those C-sections and those episiotomies, they're used to be able to gain time as well during labor.
So how many women at the end of the day are victims?
So we don't have a lot of statistics, but we believe that in the OECD, it's about 1 in 4 women, but most of them actually don't see this type of behavior as being problematic. And it's important to say that also doctors don't even see as an issue. They don't do it on purpose, if you will. It's unfortunately a behavior that is passively transmitted in the workplace. And there are different reasons for that, of course. The profession in itself has been male-dominated for a very long time. They're told in medical school to focus, at least in the West, on the organ and the disease and not the patient. There's this idea that women have been giving birth since the beginning of time, so why now bother, if you will, to listen to them? And there's also, and I think this is very, very important, the current working condition of caregivers. Today in France, every OBGYN is asked to have one patient every 15 minutes. That doesn't give you time to connect to the patient, to talk about perhaps their childbirth plan. So everything is going much faster. You also have to think that 2/3 of maternity wards in France have closed in the last 30 years. So today, what we're really seeing is that we're in a dead end with some doctors saying, not wanting to change their ways, and women who are literally turning their backs on the system and saying, we're going to home birth, doulas, and not wanting to have to do anything to do with those doctors. So we really need to go for a new therapeutic alliance between those women and those doctors.